Hi, welcome to Chapter 1. We're really going to cover strategy, development, and the strategic mindset. This is really an overview chapter that kind of sets the stage for the rest of the semester. And as you work through this chapter and this lecture, we're really going to cover a lot of the things that later in the book we're going to get into a lot of detail. Throughout it, I'm going to comment on some of the stuff that I've left in here from the author, but then also compare and contrast with my 25 years in healthcare. So let's go ahead and get started. Our learning objectives for Chapter 1 are the following. We really want to drive home the point that devising a strategy, it's not a lockstep process. It can't belong to a single department. Your entire healthcare institution, your entire hospital, has to embrace strategy. They have to embrace where you're going, and that's your job as a leader to set that and go forward. And everybody has to understand how they contribute. So as you develop that good strategy, it must be strategy that is focused and clear. Two very important terms: focused, specific, measurable, attainable, and clear. Clear for understanding. I'll use an example here. When I opened my new hospital about 1.5 years ago, we invested about $1.5 million in salaries before the hospital ever opened to bring everybody into the institution for a month before we opened. Every day at 12:30 in the afternoon, we would bring everybody down to the main lobby of the hospital. And what we talked about was strategy and culture. And it came down to, as the leader of the institution, I wanted to be able to articulate a strategy that our associates could easily repeat, easily focus on, and they knew what we were using as our benchmark. We were going to open a hospital, and we were going to be ranked in the top 1% of quality in the country based on CMS core measures, the way every hospital is measured, and we would be the #1 recommended hospital in the state of Florida. Simple strategy, very focused, very specific measurements, very clear. We had much more that went underneath that, but that was going to be the guiding strategy that we were going to focus on, and that our associates at any level could grasp. They were going to be working in the highest quality hospital in the state of Florida, and they were going to be the #1 recommended hospital in the state of Florida. Strategy, as we developed it in the boardroom, had to connect with those tactics employed in the marketplace. So that strategy overall that we talked about had a series of steps on how we could do that. And that was actually one of the discussions that I had with the board when they hired me at the hospital. They wanted this hospital to be different. They wanted this hospital to open and be unique from day one. But I think also I got to tell you, and I think we'll learn this throughout the semester, there's no single correct strategy. Alternatives abound. And the most important thing is you can change course because the market is going to demand that you should. Why and how? The equilibrium is going to be upset. Look at what internets did to newspapers. Newspaper circulation has decreased. Advertising in newspapers has decreased. Everything is on the internet. News is instantaneous now. You don't have to wait. And there's still legacy. There's still legacy out there in newspaper and individuals who like to get their news from newspapers. But I would argue that you don't. Those of you that are of this age, you get your news off of Google. You get it off of MSN. You get it off of MSNBC. That could be even dated now at this point in time. The other one that we talk about here, and where internet disrupted an entire industry and destroyed it, is if you look at the industry of travel agencies. Travel agents used to be the only way for you to book travel. You had to go through a travel agent to book an airline. You had to go through the travel agent to book your plan of course, book your hotels, book your rental car, do everything else for you. They would even sit down and give you paper maps that would bring you through the entire organization, and it would bring you through the entire route. It takes you 30 seconds or less now on Google Maps to do that. That entire industry is gone. It was just taken over by the internet. There are some that exist, but what they did is they adjusted their strategy, they adapted to the new market and the new market forces, and found niches out there. For instance, some found niche in luxury travel, where you've got individuals who their time may not be worth booking all their trip, and to them, their time and the value of their time is worth finding somebody who can book and schedule and plan everything for them. So they found niches. But the equilibrium's always going to be upset. Why do companies fail? Because they don't see it. They don't see it. I mean, they'll sit and wonder and talk about how we've always been the best. Here are our expectations, and we always hit it. And boy, aren't we great. We have all the resources that we need, and they'll always be here. And those resources and the facts substitute for creativity. Summed it up, it's the inability to escape the past. What worked for us today is going to work for us tomorrow, it's going to work for us 5 years from now. Travel agencies that didn't recognize they had to change their course failed. Those who recognized that their systems had to be optimized, that they needed to understand the rules were changing, and in a lot of issues, the rules change daily. Even in healthcare now, the rules change daily. We're an industry that used to change over decades. The federal government would change a law. It would get tweaked over 4 and 5 and 6 years in several sessions of Congress, and there would be comment periods, and hospital industry or the healthcare industry would comment on it, and then it would come back and they would rework it in Congress, and then we would comment on it again, or they would publish something, and then if they tried to apply it, it wouldn't work, and they would hold it. Look at ICD-10. The rest of hospitals around the world implemented it how many years ago? We keep delaying it. We aren't very adaptable and weren't very adaptable to new rules. We've had to be able to. We reinvent ourselves. We reinvent what our leaders are. We reinvent what success is. And that success confirms that we took the right strategic initiative. If you can't invent for the future, if you can't see that your world today is rapidly disappearing from underneath your feet like sand, you will fail. Healthcare today is akin to having 1 foot in a canoe and 1 foot on the dock. It's a juggling act because of the Affordable Care Act pushing us forward to actually look at preventative care models, look at community health, and we're on the other side still getting paid fee for service, still getting paid for doing more, still getting paid for readmissions. Well, that's all changing now, and we have to adapt. And we have to realize that acute care hospitals were once the cash cow of the system. Acute care hospitals are rapidly moving to cost centers. You really have to look, and we talk about important mindset ideas, and I think this is really getting to is you search for the driving force. What is the heartbeat of the organization? What is our core strength? Let's reflect back to the story I told you about my hospital. The core strength of the hospital really boils down to the experience of its patients and the families who access us, and the quality of care that we offer. Plain and simple. It really comes down to that. And if we build our strength around that, we become the hospital of choice. People want to come back to us. Physicians trust our quality of care. And as a hospital of choice, we build momentum. And that strategy of building upon our core strength makes us a financially viable organization. You also have to admit and understand that failure is possible. You've got to understand that everything you try won't work. And that's really hard to do sometimes. It's very humbling as a leader or as a board or as an institution to say we were all behind this strategy and we all invested in it, and 6 months later say, you know what, it failed. You may want to go out and read some articles on failing fast. Organizations today have to understand and fail fast. You rapidly identify those strategies that you went into that aren't working and get out of them before you overinvest capital. And again, we keep coming back to that clear and focused strategy. Where exactly are we going? But another thing that happened in healthcare, and we'll talk a lot about this in Chapter 2 and 3, is focusing on the customer. The customer turned our organization upside down. It used to be for years, customers did not understand healthcare. They really didn't. They really didn't. They knew if you were nice to them or not. They didn't understand our pricing. They didn't understand what was going on in our organizations. They really didn't understand what was happening to them. They came in, they got knocked out, they had surgery, they woke up, they went home 2 days later. Customers do a tremendous amount of research now, and they know about their hospital, they know about their surgeon, and they know about their procedure. Information is there, and they ask very, very informed questions. Transparency to the customer has completely inverted our organization. You must focus on them, and you must listen to them. And as we go through Chapter 2, and I think predominantly in Chapter 3, we'll talk about some of those forces that impact and change your strategy, and how many of those 5 forces that we talk about are really driven by your customer. It's amazing. And we were isolated from it for years in healthcare. Truly were. Change is relentless. Take that point home. I talk fast. I will pause. I will repeat that. Change is relentless. The healthcare industry changed in decades. Information technology and information technology companies change in months, in weeks. Things adapt, things change. We are now reaching that point because that rapid information, that access to information, is now in the hands of our patients, the hands of our physicians. They drive our change. Our change is constant. Our change is relentless. What worked today is not going to work tomorrow, and I can guarantee you it's not going to work 6 months from now. Institutions need a champion. If I wasn't the leader who wandered through the hospital for those first 6 months that we were open, and I still do it today and a year and a half later, and talk to my associates and say, what are we accomplishing? What's our goal? Do you guys remember our initiatives that we set for ourselves? And we reminded them, and we talk about, as I'm out on the floors and the rest of my leadership team are out on the floors or anywhere in the institution or actually anywhere out in public, we are championing the fact that we are going to be a top 1% hospital. And when we meet with our associates, I talk every time at new employee orientation, and I talk about the fact that I, as their leader, have failed them if they are not in a hospital where they provide the highest quality of care, and when they're driving home at night or in the morning from their shift, that they feel like they have to compromise care at any level, that I am a failure. So in that way, I am their champion. I am out there telling them that we've got this wonderful idea. We can be top 1% of quality, and I'm going to pull back the curtain. We are. A year later, we finally got posted on the CMS website. The feds drag their feet sometimes on getting your data in, but we are actually ranked in the top 1% of hospitals in the country right now. If you go to healthinsight.org and look at process of care, we're ranked in the top 1%, 100% perfect. But that's what our patients deserve. We've got a million good ideas. Did we have a million good ideas whenever we opened the hospital? Absolutely. Did I have a million good ideas in a hospital in Vegas, in our hospital in Seattle, in our hospital in Reno? Absolutely. You can't implement everything. Perfect example of this is the fact that when just recently, we sat down as a senior leadership team here in Jacksonville and said, we have 38 initiatives that are ongoing. 38 initiatives that 6 of us on the senior leadership team were championing. You can't do that. We sat down and boiled it down to 12 ministry-wide initiatives. And then each one of us, regardless of our roles, for instance, I'm running a dedicated campus, but I now have 2 specific mission objectives. Those specific ministry objectives allow me to focus on those 2. And my counterparts, my other 5, each have 2. We are going to accomplish those 12 ideas. We're going to accomplish those 12 initiatives in the next 6 months. And then some we'll put in place the monitor and the tracking to make sure we never lose sight of it. And then we're able to take on other initiatives. But we picked the 12 that were going to get us where we needed to get in 6 months, 12 months, and 18 months. And we're able to execute on them. Great ideas are great ideas. You have to understand what you can execute. It's all in execution. Strategies do force trade-off. This is a little bit, this topic was covered actually in the text. And I purposely left this slide in to talk about it because I somewhat disagree with it. As a leader, it's your job to make sure that if you've got the chance to rapidly grow something, you do not deplete your capital and profit. It's your job to find a balance of organizational strategies that can bring quick return on investment and long-term return on investment. Between those 2, you're able to actually find what you need. Take, for instance, the proliferation of freestanding emergency rooms. Freestanding emergency rooms, it's a short-lived window of profitability. Freestanding emergency rooms are able to charge hospital-based pricing, hospital outpatient pricing, HOPD. Look it up if you want to research it. HOPD pricing. So hospital outpatient department pricing. So those freestanding ERs are set up with a lower cost structure because they don't have all the infrastructure and overhead of a hospital, but they're able to charge the exact same price as a hospital who has all this overhead. So they make tremendous margin. It's a short window. 5, 6 years down the road, the feds and CMS are already on it. And they're already talking about the proliferation of these and what it's starting to cost healthcare with these freestanding emergency rooms because their charges are much higher for actually a lower acuity patient than a typical ER. I mean, it's like an urgent care that ends up getting reimbursed like an emergency room. It's a short-lived window, but it's a 5-year window the way the feds move and as fast as they move and as fast as the insurance industry moves. So hospitals are building these. They're proliferating. If you can build one for $8 million and you get an ROI in 1 year, you're not depleting your capital. You've got profit coming in almost day one when you really think about the concept as this thing is rolling. And you're able to get that money, spend it, and get a quick ROI, while at the same time, maybe you're out there doing a widespread ambulatory care strategy of 25 different locations that are going to take a long time to take off, whether they be imaging centers or physician offices. You've got a $25 million investment out there in this, but you've got these others that are all of a sudden coming in and driving your profits quickly. So there are trade-offs, but you can find ways, and your role as a leader and your role as the strategist in your organization is to couple those operating returns with your strategy to make sure you don't get depletion of capital and profit. It can happen. Your job is to make sure it doesn't. Should we focus or be diverse? Well, I just told you the story of 35 versus 12. So you need to focus. But what I will tell you is you can be diverse with focus. Now I know that doesn't make a lot of sense, but if you look at this slide, our focus would be to expand our clinics in northern Arizona. This is what we do. This is what we do best. This is our region. This is where we're at. And we're going to expand clinics. But we may say, wait a minute, with the Affordable Care Act, we've got to cover everything. We've got to cover, quite literally, cradle to grave. We've got to do OB, pediatrics, primary care, acute care, post-acute care, skilled nursing, home care, hospice. One end of the spectrum to the other is what we have to cover. So, how do you do that? It also becomes a resource allocation. You can be diverse if you've got the resources. So it goes back to our previous slide. You've got to be able to focus your resources in order to meet your strategic objectives, but you can't be so diverse that you spread your resources too thin and you can't accomplish it. If you had the staff and you had the expertise to accomplish these 6 in the diverse column, where within each of those 6 categories you had a very focused team on them, you could accomplish it. But if you really didn't know the home care business and you really didn't have the resources around, dabbling in it could lead to $1 million loss overnight. So it again comes to balancing your resources, looking at where you're at, and deciding what you can actually accomplish. Other things that are useful when you're talking about creating a plan is you need to find that you've got an advantage that's discernible from the competition. What is your strategic difference? What makes you different from your competition? My competition locally probably didn't have a great, did not have a great history of quality, did not have a great reputation. So what was the number one strategy we laid out for the hospital? We're going to be in the top 1% of quality in the country. I'm not going to talk about my competition, but I already know what the reputation of my competition is in my community. They have a reputation for not good quality. So if I am holding myself out and actually hitting the standard as being a hospital that is ranked in the top 1% in the country, my consumers and my customers, by virtue of hearing that I am in the top 1%, went, wow, this hospital's really different from the other one that we have in town. Because we've heard, or we know, or we've experienced poor quality. This hospital is ranked by an outside entity as top 1%. That's my specific advantage. Creating barriers to entry and exit. I actually did this in Reno. We had a rehab hospital that, when I first took it over, was losing over $1 million a year. When I left Reno, it was making $3 to $4 million a year, and completely full. And had our competition entered the rehab market at the time when we were losing money at it, they could have gotten in and had similar results to what we did, made a very profitable rehab hospital, and we would have never gotten off the ground. As it was, we got our hospital up, running, operated, and then we actually raised the bar. We went out and got a variety of different accreditations. We invested in our physicians to make sure they were board certified. We invested in infrastructure with physician coverage. We invested in infrastructure with specialists. We invested in all of our nurses and made sure they were certified rehab nurses, accredited. So by the time we were making strong margins, well into double-digit margins, nearing 20% margins, when our competition could look at our state data and see what our margins were, it was too late and too expensive for them to get in the market. We had gone from a census of 13 to a census of 64 patients a night. That was all the beds we had. And there was no more market share out there for our competition to get into. They would have had to come in and invested extremely heavily to get to our same level and to try and pull market share out of us. So we had created a barrier to exit. The authors talk that diversion and dissuasion in an open not-for-profit world is difficult. It's really not. If you are not using diversion and dissuasion at times, then you are not strategic. Another great Reno example, we had the community-based hospital, which I was responsible for, acute care hospital, and it sat in South Reno. Our sister facility was downtown, and the number 2 market share hospital, our competitor, sat about 4 miles from our sister hospital and was attempting to catch up with our sister hospital to become that tertiary center, and was blindly focused on our sister hospital. And our sister hospital did exactly what we needed them to do. They stood toe to toe and slugged it out. Well, while they slugged it out, I was able to actually research our competitor, find that they had the best payer mix in the entire community, coming out of a community that sat south of them, that actually travel patterns brought them to the faster hospital. But if you looked, I was easier to get to at mine. So I went out through a grassroots effort of meeting with employers, meeting with schools, meeting with PTAs, very quietly, while they were focused on competition and slugging it out with my sister hospital downtown. I worked that other market, and when they woke up, I took all of their market share and was able to pull it to my hospital. And then that weakened them. They no longer had the resources to fight our sister hospital. So it's there. They had to go and find growth elsewhere. And there is always growth in your market. There's always growth in your market. You're either creating the need for growth, creating a new service line, or you are pulling growth out of your competitor. Being willing to fall on your sword is actually pretty significant. I mean, when you come down to standards of practice overall, and you really look at what it means to enforce those standards of practice. I sat down with our medical staff when we opened and said, we're not going to bring individuals in here of questionable quality. There may be guys and girls, women who are very, very busy physicians. They bring a tremendous amount of revenue in, but you hold your breath every time they walk into the OR, waiting for the lawsuit to happen, waiting for the patient experience to crumble, waiting for the questionable quality. You have to rely on your ethics. You have to recognize that your ethics are all you have. And even as a leader, personally as a leader, all you have are your ethics. When you start compromising them, people see it. They recognize it. The other thing that I'll tell you, we'll throw some leadership skills in here as we go through the year. You're always on stage. As a leader, you are always on stage, whether you're at your hospital, whether you're at a community event being sponsored by the hospital, or whether you're at a restaurant in the community. I am never just Blaine Claypool. I am Blaine Claypool, the president of. I am always an extension. You must always set your integrity and hold to it. And that's really what falling on your sword gets down to.